We're about to dive deep into the truths and myths surrounding the life expectancy of stroke survivors. There's a common belief that strokes drastically shorten life expectancy, and while there's some truth to this, it's not the full picture. Life after a stroke can be challenging, yes, but it's not a foregone conclusion that survival time will be significantly reduced. This belief, while widespread, can be misleading and even harmful, fostering despair when hope is needed most. It's crucial that we discuss this topic not just to dispel misconceptions, but to provide a more balanced and realistic perspective. Many factors influence stroke survival, and while certain aspects can be daunting, there's also a host of positive strides that can be made in recovery, but we'll get to that. For now, let's focus on breaking down the general belief about stroke survival. So, are you ready to break some myths and uncover the truth? Let's shatter a myth. Not all stroke survivors have a drastically reduced life expectancy, but what does the data say? Well, let's dive in. When we talk about life expectancy after a stroke, we're dealing with averages. The average reduction in life expectancy for any type of stroke is around 5.5 years. And for hemorrhagic strokes, that number rises to about 7.5 years. But remember, these are averages, not set in stone predictions. These figures may sound daunting, but they're not the full story. They don't account for the individual's age, the type of stroke, the time it took to receive treatment, and the quality of rehabilitation. All these factors can influence the outcome significantly, often in a favorable direction. For instance, younger stroke survivors or those who receive prompt and effective treatment may have a better prognosis than these averages suggest. Similarly, the type of stroke matters. An ischemic stroke caused by a clot blocking blood flow to the brain generally has a better prognosis than a hemorrhagic stroke, which involves bleeding into or around the brain. Moreover, the statistics also don't reflect the incredible advancements in stroke treatment and rehabilitation in recent years. Today, many stroke survivors are living longer and healthier lives than ever before, thanks to cutting-edge medical interventions and comprehensive rehabilitation programs. So while it's true that a stroke can impact life expectancy, it's not a death sentence. Each person's journey with stroke is unique, and the road to recovery can be a long one. But with the right care, support, and determination, many stroke survivors are defying the odds and leading fulfilling, meaningful lives. So it's not as clear-cut as it seems, is it? Life after a stroke can be challenging, but it's also filled with possibilities. The key is to focus on what you can do, not what you can't. And remember, you're not alone on this journey. There are countless others who've walked this path before you, and they're living proof that life can still be beautiful after a stroke. Now, what factors decide how long a stroke survivor lives? Let's delve into it. The first factor is age. Like many health conditions, the risk and impact of a stroke increase as we age. Older individuals often face a more challenging recovery and may see a more significant reduction in life expectancy following a stroke. Next, the type of stroke plays a crucial role. There are two main types of strokes, ischemic and hemorrhagic. Ischemic strokes caused by a clot blocking blood flow to the brain are the most common. Hemorrhagic strokes, on the other hand, occur when a blood vessel in the brain ruptures. Studies have shown that hemorrhagic strokes can reduce life expectancy by an average of 7.4 years, more than the 5.5 years for any stroke type. Time to treatment is another significant factor. The quicker a stroke patient receives treatment, the better their prognosis. Quick action can minimize brain damage and potential complications, enhancing the chances of a full recovery and an extended life expectancy. Then there's the individual's overall health and lifestyle. Those with a history of heart disease, high blood pressure, or diabetes are at a higher risk of stroke and may face a more difficult recovery. Similarly, lifestyle choices such as smoking, excessive alcohol consumption, and lack of exercise can also impact both the likelihood of a stroke and the subsequent recovery process. Lastly, the presence of support systems is key. Stroke recovery can be a long, demanding journey. Emotional support from family, friends, and healthcare professionals can significantly improve a patient's outlook and motivation to work towards recovery. These factors play a significant role, but remember, they're not the be-all and end-all. Rehabilitation isn't just about recovery, it's also a vital element in determining a stroke survivor's life expectancy. Let's dive deeper into this. Rehabilitation, in essence, is a process that helps stroke survivors regain their independence and improve their quality of life. But it's more than just physical therapy or learning to walk again. It's a comprehensive approach that addresses both the physical and cognitive impairments that can occur after a stroke. Rehabilitation aims to help survivors relearn lost skills, such as speech or movement, and adapt to any new limitations. This process can be a lifeline, enabling survivors to regain control over their lives, boosting their morale and fostering a sense of normalcy. But how does this influence life expectancy? Simply put, the more successful the rehabilitation, the greater the likelihood of a survivor leading a fulfilling and independent life. This can impact both physical health by aiding in the prevention of secondary health issues and mental health by reducing feelings of depression or anxiety. It's also worth noting that rehabilitation is not a one-size-fits-all approach. Each stroke survivor's journey is unique, influenced by factors such as age, type of stroke, and individual circumstances. Thus, personalized rehabilitation programs are crucial in maximizing the potential for recovery. However, it's important to remember that rehabilitation doesn't stop at the walls of a therapy room. It extends into the home, the workplace, and the community. It's about fostering an environment that supports the survivor's continued growth and adaptation. Moreover, rehabilitation is not a race. It can take months to years, requiring patience, perseverance, and a lot of hard work. But the rewards? They are truly worth it. So, in a nutshell, rehabilitation plays a pivotal role in a stroke survivor's life expectancy by maximizing their independence, enhancing their quality of life, and giving them the tools they need to adapt to their new normal. Rehabilitation is a game changer, and we'll see why in the next scene. Surviving one stroke is tough, but what about the risk of a second one? A daunting question indeed, but one that we cannot afford to ignore. After a stroke, the risk of a recurrent stroke tends to rise significantly, and this is a threat that looms large over the life expectancy of a survivor. Now you might wonder why there's a heightened risk of another stroke after the first. The answer lies in the very nature of a stroke. It's a disruption of blood flow to the brain, often due to a clot or a rupture in a blood vessel. Once a stroke has occurred, there's a possibility that the underlying causes, such as high blood pressure, heart disease, or atherosclerosis, still persist, making a second stroke more likely. So what's the impact on life expectancy? Well, it's a bit of a double-edged sword. On one hand, surviving the first stroke demonstrates a certain resilience. On the other hand, a second stroke can be more damaging, potentially leading to greater disability or even loss of life. But it's not all doom and gloom. There are steps that can be taken to mitigate this risk. It's important to work closely with healthcare providers to manage underlying health conditions and adopt lifestyle changes. This could mean anything from taking prescribed medications regularly, maintaining a healthy diet, getting regular exercise, to quitting smoking. Remember, a stroke doesn't just affect the individual who experiences it, it has a ripple effect on families, friends, and communities. So it's not just about increasing life expectancy, but also about improving the quality of life for survivors and their loved ones. The threat of a recurrent stroke is real, and it's something that needs serious attention. But with proactive management and a strong support network, this threat can be faced head-on. After all, the goal is not just to survive, but to thrive. Stroke doesn't just impact life expectancy, it changes lives, and not always for the better. Now let's delve into the long-term effects that can occur post-stroke, and how these can drastically alter one's quality of life and life expectancy. When we talk about stroke, we often focus on survival rates. However, surviving a stroke is just the beginning of a long journey. The road to recovery can be challenging and fraught with obstacles. For some individuals, the aftermath of a stroke can mean grappling with physical disabilities. These can range from mild to severe, and may include paralysis, difficulties with balance and coordination, muscle weakness, and fatigue. But the impact of stroke isn't limited to the physical. Cognitive impairments are also common post-stroke. This might mean difficulties with memory, attention, and problem-solving. Some stroke survivors may experience aphasia, a condition that affects the ability to speak, understand language, read, or write. Now imagine the toll this takes on one's life. Simple tasks that were once taken for granted may now become insurmountable challenges. Social interactions can become a struggle, and the ability to live independently may be compromised. And it's not just the stroke survivor who is affected. The ripple effect extends to their loved ones too. The emotional burden of caring for someone with these disabilities can be overwhelming. These long-term impacts can undoubtedly affect life expectancy, but more than that, they can drastically impact the quality of life. It's a harsh reality, but one that emphasizes the importance of prevention, early detection, and effective rehabilitation. Remember, every stroke survivor's journey is unique. Some may experience mild impairments, while others may face more severe challenges. But with the right support and resources, it's possible to navigate this journey and maximize the quality of life post-stroke. The long-term impact of stroke is profound, and it's something every survivor and their loved ones need to understand. Recovery is a journey, and for stroke survivors, it's one that can be long and challenging. It's a path marked by milestones, some small, some significant, but each one a testament to the resilience of the human spirit. Let's talk about the recovery process. It's not a one-size-fits-all timeline. For some, it could be a matter of months. For others, it could stretch into years. This variability is influenced by factors such as the age of the individual, the type of stroke they suffered, and their unique circumstances. Age plays a crucial role in recovery. Younger stroke survivors often have a better prognosis due to their body's ability to heal and adapt. But that doesn't mean older survivors can't make significant strides. With determination, the right support, and a positive mindset, progress is possible at any age. The type of stroke also influences recovery. Ischemic strokes, caused by a blockage in the blood vessels supplying the brain, usually have a more favorable prognosis compared to hemorrhagic strokes, which are caused by bleeding within the brain. That being said, every stroke is unique, and so is every survivor's journey towards recovery. Individual circumstances can't be overlooked. Factors like overall health, lifestyle, and the availability of support systems can greatly impact recovery. A healthy lifestyle prior to the stroke can contribute to a smoother recovery process. On the other hand, pre-existing health conditions may complicate the recovery journey. Rehabilitation plays a starring role in this journey. It's the bridge that helps survivors regain their independence and improve their quality of life. It's tailored to the unique needs of each survivor, focusing on physical, cognitive, and emotional recovery. Lastly, it's important to remember that recovery isn't linear. There will be ups and downs, progress and plateaus. It's normal to have good days and bad days, but every day is a step forward, every effort is progress, and every milestone, no matter how small, is a victory. Recovery is a marathon, not a sprint, and every step forward is a victory. So let's celebrate each victory, each milestone, and each step forward on this journey towards recovery. We've covered a lot of ground today, and we hope you found this information valuable. We've delved into the controversial truth about stroke survival, painting the real picture of what happens after the unthinkable occurs. We've explored the various factors that influence life expectancy after a stroke, from your age to the type of stroke and the time to treatment. We have also shed light on the crucial role of rehabilitation in maximizing independence and quality of life after a stroke. It's not an easy journey, but with the right support and determination, it is a journey that can lead to significant recovery and a fulfilling life. We've discussed the threat of recurrent strokes, a fear that looms large for many survivors. But we also emphasize the power of knowledge, of understanding the risks and taking proactive steps to manage them. We've examined the long-term impacts of a stroke, the physical and cognitive impairments that can affect the quality of life. But we've also highlighted the stories of resilience and recovery, reminding us all that life after a stroke can still be rich and meaningful. And finally, we've walked with you on the journey towards recovery, a journey that can take months to years, but a journey that is worth every step. Through this exploration, we've underscored the importance of raising awareness about stroke and its impact on life expectancy. It's a topic that affects us all, directly or indirectly, and it's a topic that we need to talk about, to understand, and to act upon. If you found this video helpful, give us a like and hit that subscribe button. Your support helps us continue to bring you valuable content like this. Remember, knowledge is power, and together we can make a difference.